You will now have the opportunity to practice what you have learned using an actual case study. Gemma is 45 days old. Her weight is 3 kilograms. Her temperature is 37 degrees auxiliary. Gemma has been brought to the clinic by her mother because she is sick. First, check for possible bacterial infection. Ask,
"Has the infant had convulsions?"
The mother says, no. Count the breaths in 1 minute. Prepare to start counting. Start counting now. Stop counting. How many breaths did you count? Write down your answer. Repeat the count if you decided it was elevated. Next, look for severe chest indrawing. Does Gemma have severe chest indrawing? Write down your answer. Look for nasal flaring. Does Gemma have nasal flaring? Look and listen for grunting. Look and listen now. What did you decide? Write down your answer. Look and feel for bulging fontanelle. What is your assessment? Does Gemma have a bulging fontanelle? Look for pus draining from the ear. There was no pus draining from either of Gemma's ears. Look at the umbilicus. Is it red or draining pus? Does the redness extend to the skin? Measure temperature, or feel for low body temperature. Gemma's temperature is 37 degrees. Look for skin pustules. Are there many or severe pustules? Write down your answer. See if the young infant is lethargic or unconscious. Write down what you decide. Look at the young infant's movements. Are they less than normal? That completes the check for possible bacterial infection. You should now classify Gemma. Then ask,
Does the young infant have diarrhea?
the mother says yes.
For how long?
The mother replies, for 4 days.
Is there blood in the stool?
The mother says no. Look at the young infant's general condition. You already assessed whether the child was lethargic or unconscious when checking for possible bacterial infection. Now look to see if she's restless and irritable. What did you decide? Write down your answer. Look for sunken eyes. Are Gemma's eyes sunken? Pinch the skin of the abdomen. Does it go back very slowly, taking longer than 2 seconds? Does it go back slowly?
First, let me show you how not to do it.
That completes the assessment for diarrhea. Now classify Gemma for diarrhea. We will then tell you how we classified Gemma for bacterial infection and diarrhea. We will now tell you how we classified Gemma's illness. Gemma is aged 45 days. She has been brought to the clinic by her mother because she was sick. First, we checked Gemma for possible bacterial infection. The mother said that Gemma has not had convulsions. First, we counted the breaths in 1 minute. We counted 42 breaths in 1 minute. Gemma does not have fast breathing. As Gemma was taking less than 60 breaths per minute, we did not repeat the count. Next, we looked for severe chest indrawing. We decided that Gemma did have severe chest indrawing. We decided that Gemma did have nasal flaring. We heard grunting when Gemma was breathing out. Gemma did not have a bulging fontanelle. There was no pus draining from either of Gemma's ears. The umbilicus is not red or draining pus. Gemma does not have a fever. Her temperature is only 37 degrees. Gemma does not have skin pustules. We decided that Gemma was lethargic and that her movements were less than normal. We looked at the pink section of the bacterial infection table. Gemma's signs of severe chest indrawing, nasal flaring, grunting, being lethargic, and movements less than normal are signs of possible serious bacterial infection. Next, we assessed Gemma for diarrhea. Gemma's mother told us that Gemma has had diarrhea for 4 days. There is no blood in the stools. We looked at the child's general condition and decided that Gemma was lethargic. Gemma's eyes were not sunken. When the skin of the abdomen was pinched, it went back very slowly. Look at the pink row of the classification table. Gemma is lethargic, and her skin pinch goes back very slowly. These are signs of severe dehydration. We therefore classified Gemma as having diarrhea with severe dehydration. Because Gemma had only had diarrhea for 4 days, she was not classified as severe persistent diarrhea. Because she had no blood in the stool, she was not classified as dysentery. We therefore classified Gemma as having possible serious bacterial infection and diarrhea with severe dehydration.